Hi everybody, this is Dr. Ihab Abdurrahman, Ihab Tarawa, consultant of acute care medicine, professor of medicine, University of Khartoum, consultant of acute care medicine at Soba University Hospital. This session is about formulation error, which part of medication safety. Learning outcomes, we would like to describe errors associated with wrong formulation, discuss the reason why formulation errors occur, implement a strategy to prevent formulation errors. This Hajja Amna, she's hypertensive on metoprolol, 25 milligram twice a day. She came to your office and she wondered if she can take the two tablets together, or you can upgrade her tablet to 50 milligram and take it once a day. She was taking an immediate release metoprolol, and presence of control release is an opportunity to simplify patient medication regimen. So for this patient, you can increase the dose to 50 and you can give her slow release or sustained release. Advantage of control release formulation, less frequent administration, often greater compliance, and reduce some side effects to some patient. The difference between immediate release and sustained release, if you look here, for the green line, it represents the short-acting medication. After you take the medication, it quickly enter into therapeutic window and it stays there for some time, and then it drop below the therapeutic window. So you need to give multiple doses. While for the sustained release, the orange line, it takes time to reach the therapeutic window and it stay there for long time. So we need to understand the dynamic of short-acting and long-acting medication. This patient was supposed to receive verapamil, slow release, 240 milligram. And however, the patient gave her 3 tablets of the short-acting verapamil. 90 minutes later, the patient felt weak, dizzy. She became bradycardic and she became hypotensive. The maximum total daily dose of verapamil is 480, regardless of the formulation. The dose and dosage frequently varies depending on the formulation. This is why it's important to correct formulation. The correct formulation is selected for use. For this patient who took 3 tablets of 80 milligram short-acting, so she quickly entered into the therapeutic window, and even though she went up and it became toxic, and she remained in the toxic zone, and during this period where she developed the bradycardia and hypotension, and sometimes this can go serious and can lead to first, second, or third degree heart block or even cardiac arrest. Another scenario, this patient is supposed to receive 160 milligram of short-acting verapamil 3 times a day at 8 o'clock, at 2 p.m. and 8 p.m. Unfortunately, the nurse gave her in slow release. She gave it at the stated frequency. Let's see what happened. The patient took the first dose. She remained in subtherapeutic window. Then after 8 hours, she took the second dose. She entered into therapeutic window. After she took the third dose, then she went into the toxic level. So the dynamic of short-acting and long-acting medication are totally different. Control release form of morphine was prescribed and dispensed to a patient on discharge from hospital to use as needed. A patient has long-term cancer pain. Despite taking the dose of control release, she is not getting any help. Her pain is still there. The control release need time to build up in your system. So the patient was not achieving any relief and any comfort. She took extra dose every hour. She took further dose after 1 hour, and she continued to have taking pain, and every hour she was taking another second dose. This led to accumulation of morphine and its metabolite in the bloodstream. Later on, the patient was found unconscious and she was rushed to the hospital and resuscitated in the ICU for opioid overdose. One of the confusion comes because the naming of the packaging of product play the major role in the occurrence of formulation error. Most control release formulation have the same name as their short-acting counterpart, and they add some letter or suffix at the end like XL, MR, LA, CR, and there is no consistency. And this is a source of confusion. Many of the providers, they are not aware about these letters that indicating long-acting or sustained release. Different brand of the same product may use different terminology. So there is no clue in the product name that can indicate whether it's short-acting or long-acting. If you look at this medication, the slow release and the immediate release, you cannot differentiate from the name whether it is short-acting or long-acting. Non-oral medication also available. Some eye drops like metoprolol, they have short-acting and long-acting, and we need to be careful when we are prescribing them. Some injection like the depot in psychiatry, we have short-acting and long-acting, and we need to differentiate them because they act differently. To avoid error with formulation, consider the following point to avoid error with control release formulation. Never interchange control release and short release and short acting medication. Control release product are named inconsistently. Always prescribe in generic name. It can be useful to indicate intended brand as well as generic name in hospital which use standardized prescription template. Tick on the box that showing this medication is extended release. One of the challenge facing us in clinical medicine about crushing and chewing medication. Some patients, they cannot swallow for multiple reasons, because the tablets are too big or because they have some difficulties. So administering medication to patients who are not able to chew tablets can be challenging. Not all medication have liquid form. For some medication, the tablet or capsule form may need to be crushed or chewed. However, not all can safely be crushed, so we have to review before we crush and chew the medication. Formulation that shouldn't be crushed: control release formulation, enteric coated tablet, cytotoxic air teratogens, sublingual or buccal. This cannot be crushed or chewed. The only way to know for certain whether it is safe to crush a medication is to check the product information carefully, and you can consult the clinical pharmacist. Sometime you might need to open the capsule and give it to the patient because they cannot swallow, or sometimes even those with liquid formulation, you can aspirate that and give it through the NG tube. Most capsule may be opened and the liquid or powder inside removed if necessary. It's important to remove the entire content to ensure that an accurate dose was given. Some capsules contain control release or enteric coated. So when you open them or you crush them, they will lose this property. Like, how should we, case study scenario. 83-year-old patient was given control release diltiazem capsule, 180 milligram once a day for blood pressure control. Because the capsule was too large to swallow, the patient chewed the medication. As a result, she suffered 2 episodes of severe dizziness, and her family contacted the pharmacist for advice. Upon learning that she was not able to swallow or because she was chewing the medication, the community pharmacist suggests that the GP substitute the control release of diltiazem with short-acting medication, which can safely be chewed. The prescription was changed to short-acting diltiazem 60 milligrams 3 times a day, and the patient did well and she was able to cope with her medication. Several months later, the same patient was admitted to the hospital for minor surgical procedure. Upon discharge, the pharmacist suggests that the doctor should simplify her medication and change diltiazem to a slow release 180 milligram once a day. The patient again started to chew her medication and she became progressively weak and she was found dead at home. Probably she had severe hypotension or even complete heart block or cardiac arrest. Combination of medication is one of the formulations that we need to pay attention for. Combination product contain 2 or more active ingredient. They can help to simplify patient medication regimen and promote adherence, especially in conditions for which there are an increasing number of combination products like Parkinson's disease, cardiovascular condition, diabetes, pain, medication. Error can occur due to lack of familiarity with these products. Case study. During the ward round, the consultant questioned why this patient with ischemic heart disease was not taking statins. No one in the ward round was aware that the ingredient cadwet, which is a combination of amlodipine 10 mg and atorvastatin 80 mg. The patient was prescribed atorvastatin 40 milligram in addition to what she has been taking. So she ended up taking 120 milligram atorvastatin, exceeding the maximum dose, which is 80. She took 3 consecutive doses in hospital before the error was discovered. Brand name shouldn't be used to prescribe in prescribing combination product. Even if you use a brand name, you have to write between bracket the combination. A child with cerebral palsy was taking regular diazepam as an antispasmodic. On admission to hospital, his mother reported that his usual dose was 2 ml 4 times a day. The mother gave the bottle to the nurse. It indicates that 10 milligram per 10 ml, which means that each meal has only 1 milligram. The total dose the child was taking is 2 milligram, that is to say 2 mils. The doctor misread the label and he thought it is 10 milligram per mil and he prescribed 20 milligram 4 times a day instead of 2 milligram. The child was in overdose. He has experienced narcotic overdose and become unresponsive, rushed to the ICU and resuscitated there. It's important to prescribe the dose of liquid medication by weight rather than volume because some medications are available in more than one concentration. Another problem with the formulation, some medication are given by devices: transdermal patch, inhaler, nasal spray, pessaries, suppositories, sublingual tablets, transmucosal lozenges, auto-injection, and many others. The device needs to be used correctly and ensures that the drug delivered in a safe and effective manner. Before administering any medication via unusual device, healthcare professional must ensure that he is aware and know how to use the device and how to educate the patient about using the device. Patient must always be educated to use the new drug delivery device. Even if the patient was previously been using the device, it is wise to check that he is using the device in a correct manner. A patient complained that her asthma inhaler is not helping her. Upon reviewing the way she's taking the medication, they recognize that she doesn't remove the cap. The way the pharmacist was teaching her, he showed her how to use the medication, but he didn't remove the cap, and the patient thought that the cap should be there when she's taking the inhaler. Uh, If there is any precaution, we need to express this to the patient and family. A patient carer placed fentanyl patch on the patient lower back over her pain side. She also placed heat pad on the same area. So the patient was found unresponsive because the heat increased the absorption of fentanyl and it led to narcotic toxicity. Take home, presence of large number of different formulary is a source of confusion and errors. The potential for formulation error is high. Recognize issues associated with selection of wrong formulation of a medication can improve patient safety. Be careful when you are handling a medication that you don't know or you are not aware, or handling combination of a medication. Thank you.